Imagine walking into your trusted neighborhood clinic, a place you've counted on for decades, only to discover a shocking secret behind the counter. Stay with us, because what we're about to reveal might change how you view your next doctor's visit. This is 2230, and if you think you've heard it all, trust us, you haven't. For more than 4 decades, a doctor practicing in Bedok has been a familiar face to residents in the area. This doctor, with 45 years of experience since 1979, worked at the Civic Clinic along Block 537 Bedok North Street 3. Over the years, patients came to know him as a knowledgeable and respected figure, but all that trust came crashing down when a disturbing medical malpractice story emerged. A longtime patient of this doctor, now 75 years old, blew the whistle. He first started seeing the doctor at age 55. For 14 years, he reportedly received concurrent prescriptions of 2 benzodiazepine-based sedatives. Benzodiazepines are no ordinary pills, these are potent drugs usually prescribed to help with anxiety and insomnia, and they must be handled with great care. But instead of careful oversight, this patient was prescribed these medications repeatedly, to the tune of about 4,975 pills over 17 years. Let that sink in. Nearly 5,000 pills to one individual, involving 7 different kinds of benzodiazepines. If that sounds alarming, it gets even more troubling. There were at least 107 occasions between 2002 and 2019 where the patient picked up his meds without a formal consultation. Imagine going to a clinic and getting your potent prescription replenished time and time again with barely a glance from the doctor. What does this say about patient care, or the standards we trust our doctors to uphold? The Singapore Medical Council took action. The doctor admitted to mixing medications improperly, allowing non-consultative dispensations, and, importantly, failing to refer the patient to a specialist despite clear signs of dependency. He knew the patient was becoming reliant but didn't document referrals or follow the proper channels. According to the Medical Council, this represents a severe breach of trust and professional guidelines. The doctor tried to defend himself, saying he prescribed low doses and advised the patient to take them only when needed. He claimed that out of genuine care, he wanted to help the patient live normally, even waiving fees initially and then later increasing prices to discourage dependence. He describes the patient as stubborn and short-tempered, refusing formal consultations, which led him to observe the patient through a one-way mirror. He even insists that he attempted referrals to a psychiatrist, but the patient supposedly refused every time, leaving no paper trail. He expressed regret and requested a hefty fine of 100,000 Singapore dollars instead of suspension, partly blaming his own stress and anxiety as he battled cancer during the proceedings. But the council would not yield. They imposed an 8-month suspension, starting December 16. Now, the Civic Clinic has a new doctor on duty, leaving some residents in disbelief. Local patients, many of whom saw the suspended doctor since their youth, expressed shock and disappointment. Imagine having faith in a medical professional for decades only to find out about such a mismanagement of care behind the scenes. Before you go, we want to hear from you. Do you think an 8-month suspension is a fair penalty for what happened here, or should the punishment have been more severe, or more lenient? Let us know your thoughts in the comments section below. And while you're there, smash that like button if you value in-depth investigative news, share this video with friends who trust their long-term doctors, and hit subscribe to 2230 for more stories that delve beneath the surface. Your voice matters, so we're counting on you to join the conversation.